Albendazole is a medication used to treat certain tapeworm infections, such as neurocysticercosis and hydatid disease. It is important to take this medication as directed by your doctor. The dosage and timing of taking albendazole will depend on the type of infection and your medical condition. Be sure to follow your doctor's instructions carefully to get the most benefit from this medication. When taking albendazole, it's important to follow your doctor's instructions. Usually, you'll take it 1 to 2 times a day with meals. If swallowing tablets is difficult, you can crush or chew the dose and take it with water. For certain conditions, such as hydatid disease, your doctor may have you take albendazole in a treatment cycle. This could mean taking it twice daily with meals for 28 days, then stopping for 2 weeks. Be sure to carefully follow your doctor's instructions. The dosage of albendazole is based on your weight, medical condition, and how you respond to treatment. To get the most benefit from albendazole, take it at the same time each day. If you're on a treatment cycle, mark your calendar as a reminder for when to restart the medication. Keep taking albendazole until you've finished the full prescribed amount, even if your symptoms improve. Stopping too early could cause the infection to return. Depending on your condition, your doctor may also prescribe other medications, such as corticosteroids or anti-seizure drugs. Be sure to follow your doctor's instructions for those medications as well. While using albendazole, avoid consuming grapefruit or grapefruit juice unless your doctor or pharmacist says it's safe. Grapefruit can increase the chance of side effects with this medicine. If your condition lasts or gets worse while taking albendazole, be sure to inform your doctor. If you experience nausea, vomiting, abdominal pain, headache, or temporary hair loss while taking albendazole, it's important to let your doctor or pharmacist know. Keep in mind that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience severe headache, vision changes, yellowing of the eyes or skin, severe stomach or abdominal pain, dark urine, unusual tiredness, easy bruising or bleeding, signs of infection, signs of kidney problems, confusion, or a very stiff neck. In rare cases, albendazole may cause a very serious allergic reaction. Seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to consult your doctor or pharmacist if you notice any other effects. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking albendazole, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any history of liver disease, biliary tract problems, or blood/bone marrow disorders. It's also important to limit alcohol consumption while taking albendazole, as it may increase the risk of liver problems. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as albendazole may harm an unborn baby. Your doctor may order a pregnancy test before starting this medication and may discuss reliable forms of birth control. If you are breastfeeding, it's important to consult your doctor before using albendazole. When taking albendazole, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of albendazole. If someone has taken too much albendazole and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek medical help immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Albendazole is a medication that should only be used for the condition it was prescribed for and should not be shared with others. Before starting this medication, you may need to undergo lab and/or medical tests such as liver function tests and complete blood counts. It's important to keep all medical and lab appointments and consult your doctor for more details. For the best results, it is important to take albendazole at the same time each day. Remember to take it as directed by your doctor and do not change your dose without consulting them first. This medication can be taken with or without food. If you have trouble swallowing the tablet, it can be crushed or chewed with a little water. Be sure to wash your hands after taking this medication and avoid contact with others for a few days to prevent spreading the infection. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next one at the usual time. Don't take a double dose to make up for the missed one. When storing albendazole, make sure to keep it at room temperature and away from light and moisture. It's important to keep it out of reach of children and pets. You should also avoid flushing the medication down the toilet or pouring it into a drain unless specifically told to do so. When the medication is expired or no longer needed, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.